Thank you, Gopal. I deem it a privilege to be addressing the Indian Chamber of Commerce in Houston. I wish to thank Dr. Slopa and Vibhuti Mishra for enabling me to come here. And it's the first time I'm coming to Houston. And the last few days have been a real eye-opener for me, and I take back a lot of things I've learned. I'm amazed at the excellence achieved here in healthcare, and I can see the line of hospitals just in this small area, which are all world names which we've heard about. One striking thing which I think most of you who are from India will recognize is the number of patients per doctor in India is much more. And that's one thing we struggle with. So we have to see, say, 2 or 3 or 4 times the number of patients. So thereby there's always a struggle of clinical work, and when the question was asked about research, the time and energy given for research takes a beating always. So that's one striking problem that we have as a difference to here currently. I'm trying to think what I can do to, in the next few minutes, try to introduce Vellore to you, and that I think that's what I'll do. I'll hand over the investment opportunities to Dr. Vibhuti, who will talk a bit about that at Vellore. Now, Vellore is in South India. It's right below Chennai. It's a unique place. It's a mission hospital started by an American medical missionary. It's the Scudder family. Dr. Ida Scudder started this hospital in 1900. Some of the work at Vellore has impacted national policies in India, and I'll give a few examples. One is the Pulse Polio campaign. You must be aware of that. The regular dose of polio vaccine are not enough, and extra dose of Pulse Polio is done all over the country now. This is work done about 20-30 years ago by Dr. Jacob John and team at Vellore, which is now a national program. We have currently ongoing work on rotavirus vaccine, which is a collaboration between Dr. Gagandeep Kang in my own department and Professor Mary Estes here, who's in Baylor College of Medicine. Let me talk a bit about training. Vellore is known for its training. What makes a training at Vellore so special? One of the things is the training imparts a set of values which are imbibed by the student in the sort of environment that it trains in. In fact, they say that a student who's trained at Vellore, once he comes out, is often confused and is sort of a misfit for society. That means he finds that society is not all black and white, and it's more grey, and thereby to work in. And in fact, some people say that people move out of India and work abroad because we find a more easier place to work in, where there's a lot of corruption in India, and that's a daily problem. And how does one work in this situation? I've been privileged to be invited here along with Dr. Sari to represent India. And I know I have no way at his stature, but let me just talk a bit about the work he has done. In 1 year's time, Dr. Sari and his team has really turned around Medical Council of India, and that's such an important body which regulates medical training in India. Just an example. At Vellore, we have been trying to get permission to start new postgraduate courses. We have all the facilities available, there's enough patient load available, there's enough faculty to teach, there's all the infrastructure needed. For 12 years, one course, a specialty in endocrinology, just couldn't get recognition. Just couldn't get permission to start the course. We had, like that, I believe, about 67 postgraduate courses awaiting application to move forward from the regulatory agencies. At the same time, there were newer and a variety of newer colleges coming up which could start their courses overnight, while for 12 years CMC is not able to get it done. Now, in this last 1 year, suddenly all over India, Dr. Sarin's diagnosis was that there are not enough doctors for the country. That's a problem. And the solution is to open out more courses, open out more training opportunities. And what would it happen for over a 30-year period at Vellore? Suddenly we have got a variety of courses open, and even the last few weeks we had more and more courses coming up. So that's really amazing as to what has happened there. Now, CMC Vellore focuses on the underprivileged society, and that is determined focus, and that continues. A student who trains there imbibes all these values. He is aware that these courses never came through, and still CMC took the difficult option of saying, rather than pay bribes to get courses sanctioned, for 12 years you don't have a course going. That's a tougher option to do. So such values are imbibed in students without anyone stating these wrong. So I'll just conclude here to say, I'll just state like this, that investment opportunity, Vellore as an institution per se, is to support the work in Vellore, which however is very difficult to describe. And the work is really divided into training, a variety of medical personnel, as well as ongoing patient services, clinical services, which are focused on the underprivileged. Thank you so much.
In the interest of time, I will move to the third speaker and then open it up for questions. It's Vibhuti Mishra, my husband, actually, and he's a neurologist and chief of neurology at Fairfax Hospital in Virginia. And he's very passionate about investing in India, both from the biotech side as well as at Vellore. And it's a conversation with Shiv on a car ride that generated this acceleration of courses being accepted in Vellore. So I'll let Vibhuti forward.
Lopa always tells me I'm too idealistic. I don't see anything wrong with India ever. I see problems, but I don't see that there aren't problems anywhere else. And I see solutions, I don't see anything bad. And then you ask me, why am I over here? Why am I not in India? I don't have an answer to that. So don't ask that question, that's one question again. Okay, so this is very stupid. I, as a doctor, am talking to industrialists and business people about investment opportunities. So this is almost as bad as you trying to teach me which part of the brain I'm supposed to take out for seizures. So please forgive me. And so what I'll do is I'll ask your help to go along and correct me as I go along. And I did take some help. I asked Lopa's cousin for help, and he's one of you, Apu Bhai Patel. He's a very, very strikingly successful businessman. So he guided me, and so if there's anything wrong, catch me. Okay, but he didn't have too much time to train. So a little bit about my background. It comes from Vellore, so let me start with Vellore. It's a premier private non-profit medical center in India, consistently ranked second in India for the past, I don't know. And anytime it was ranked anywhere less, it was not correct. So 100 years of experience. It started over 100 years ago as a small dispensary by IACCGH. 2,700 bed hospital, every single specialty available. 2.1 million outpatients a year, 700,000 patients annually. And Vellore spends $12.5 million US of its own money on looking after patients, subsidizing care, its own money. How does it do that? That's very interesting. One small point, Dr. Epen gets paid 60% the salary of the usual medical college government doctor. He takes a salary cut but still works there. Undergraduate, graduate and postgraduate, medical, nursing, allied health sciences, everything is available in Vellore. Okay, so now what's my role in it? I was trained in Vellore and I've left the country, so what am I doing over here? I'm part of a foundation which was started in America to support Vellore. In the past, it was a much bigger part of the help that Vellore got from everywhere else, but now it is smaller. So there's a grant from the US government that we managed to help other people get hold of, and so we are able to transfer $600,000 of grant money every year to Vellore with the help of other people over here who write the grants and get the money, and we channel it with the expertise of the Vellore Foundation. We collect money. We collected $2 million for a building called the IACCGH building for women and children. The focus in Vellore has always been women and children and people who couldn't afford education. That is something which continues to be a problem. I think when everybody said India is shining, we in Vellore knew exactly it wasn't shining in 70% of the households in India. So we are fully aware of that. Services, we provide services with personnel in departments about $130,000 a year. And of course, disaster relief, subsidized healthcare, student scholarships, new equipment, continuing education that comes to about $1 million a year. So this is the foundation part of it. So what is the Vellore now doing about the future? As you know, this is a very technologically advanced institution. There are inventions being made every day over there. There are developments. For example, when I was there in the 70s, I used to be amazed that the professor of biochemistry had rigged up a multi-channel analyzer with little polythene tubes, little pumps made in the local shops in Vellore, and he had actually taken one of these machines that you would see would cost $100,000 over here. He'd make it for probably less than $10,000, and we would run all our sodium, potassium, chloride, and all those tests in this little rigged up thing in a building that was built in 1935. And he provided standardization to other laboratories. The World Health Organization has made Vellore's laboratories the standard for providing standards to other laboratories. 2,700 laboratories come to Vellore's medical laboratories to provide the standards. Okay, so this is one part. So other things, the Vellore hand. Have you heard of the Bombay Vellore hand? In 2000, there was an Indian Institute of Technology invention which invented an arm which has motors and hooks and pulleys and can carry out motions like abduction, flexion, extension of the wrist and fingers, pincer movements, picking up, everything. All made in Bombay, Hawaii, and then field tested in Vellore. And then later developed, the person who was working on it in Hawaii moved to Vellore and what's his name? I've got his name somewhere, I'm sorry. He is still working and developing the whole thing. The problem with it is that it is made on a cottage industry like basis. You order one, the guy goes out and makes one for you and fits you up. In a small shop in Katpadi, there's a foundation that makes it. So this is the first thing I presented to Akubhai, and Akubhai said, so how are you going to get people to invest? So this is, of course I don't have the answer. You can go there, and the way it is set up, any one of you can go there and say, okay, we'll take over this manufacturing. And we'll do the rest. Instead of making 4 a month, we'll make 400 a month. And he said, is there a market for it? What do you think? Have you heard of the Jodhpur and the Jaipur foot? Nobody even bothers about a market. Okay, if the first 1,000 people don't buy it, the next 10,000 will buy it, or the next 100,000 will buy it. There are amputees in India with all the industrialization going on and the traffic being as bad as it is. Let me move on. So there is another very, very interesting phenomenon that happened. When I was there 30 years ago, the pharmacy used to make intravenous solutions. They used to make ointments and little formulations of that sort for all sorts of things, from burns to scabies to everything. They can't anymore because of the rules and regulations in place. Hospitals cannot be manufacturing units. But the expertise is there. And that can be simply taken out and manufactured outside and provided. All the equipment, all the knowledge is sitting over there with the people in the pharmacy department. They simply cannot do it. So that's an investment opportunity. Vellore Foundation is going to help with these kind of investment opportunities. We have in our body people who are doing nothing but funding and founding technology parks all over the United States. We want to make a technology park in Vellore and be able to provide business opportunities to make all these things. Dr. Sarin said, we need the doctors to have a second income. This is the second income. They're already inventing things. All we have to do is market it. And this will be their second income. It will make doctors want to go into it. It will bring the right kind of people into it, the people who are interested in inventing and creating things. So here is the Vellore hand. It's the same scale that he talked about with the Shanta Biotechnology vaccine. It costs a fraction of a similar hand over here. You can imagine that. It's very, very inexpensive. Ordinary people can afford it, almost. I don't know how much it costs, I should have checked that out. Association over here of Research University Pathology Laboratories, in association with the University of Utah, that provides specialty laboratory services. And what they've done is that they provide additional services like consultations and genetics and esoteric laboratory tests. That service system has earned them $500 million in 2009. Vellore already has those service systems. They're already connected to other laboratories. People already send them the whole thing. They do it on a non-profit way. This is something which can be, we are actually setting this up right now. In association with the ARUP, which is ARUP, Association of Research and University of Pathology Laboratories. That's something that requires investors. I'll stop there, and if you have any questions, I can go further. Thank you very much.
Happily take questions, and I apologize for not introducing Vibhuti properly. He went to Vellore, he obtained his MBBS, his MD at Vellore, won a gold medal, series of gold medals at Vellore, and then went to England and obtained his MRCP, and then to the United States where he worked under Tom Waldman at NCI, a member of the National Academy of Sciences in Immunology, and then went on to and now he has 4,000 patients in a large neurology practice amongst a research program. So but this is a passion, as you can see, and we'd love to take questions at this point in time. Yes. And there's a mic right behind you. So if you can...
My voice is public health, and I am very interested in knowing if the Indian healthcare industry is actively studying medical errors, and are they incorporating medical ethics in their thinking and so on. I'm very interested in these two topics.
Before you answer, I would like to make a request to the audience. And now is the time for you to start filling out the surveys. We do want you to complete your surveys before you leave. And now I'll let the panel answer the question. Thank you.
Mr. Alwani should become the chairman of the Indian Parliament. What do you think? Get all our bills passed.
The question you asked about the medical errors, I know about 100,000 deaths occur even in